You're listening to the PT Pinecast, where smart people in healthcare come to make noise. Here's your host, Jimmy McKay.
All right, guest today is a founder, a CEO, a professor, all those things all at once, who's bridging the gap between artificial intelligence and physical therapy. They're closer than you think. She's not just talking about the future, she's already building it. From AI-powered clinical tools to health tech education reform, she's changing how healthcare sees itself. Let's welcome today's guest. Hoda, welcome to the show.
Thanks, Jimmy, for introducing me, and I'm happy to talk and introduce myself.
Perfect. All right, well, let me take some words out of your mouth, and let's see if we can get you to explain them. You say AI is already here. What parts of our profession of physical therapy and healthcare are already being impacted, and then most PTs might not even realize it?
So, two things have been impacted very much. One is patient monitoring. People look at the documentation piece separate from the patient monitoring, but it's something that is integrated. It's not something that people can separate documentation as a whole task separate from monitoring, because they are all integrated in one task. But they just like to highlight that piece more than the patient monitoring, because we need to, documentation is basically monitoring, but it's just like now it's very like highlighted for the purpose of the insurance companies. But basically this started for monitoring the progress of your patient, and the patient monitoring is not like a solely kind of like a narrowed down to documentation. It's part of it is also like monitoring the hip, home exercises, and see the progress of your patient. This is something that is very much neglected actually, like in our like a service, in our like a job. And these two pieces are the main function of AI. These things, patient monitoring, that is combination of, I think computer vision is the main piece for monitoring people. RTM software, something that you can track people at home, like a homework system, like when you're tracking the students for the function and also their performance. And the other piece is documentation that show their progress. And you can see like how these things are smoothly integrated together. The other piece that started but not also perfectly focused is about AI literacy. This is something very much missing. And I thought like I'm actually like try to be hands-on on patient monitoring as a CEO of the HemScap, try to bring up the pivotal PT integrated documentation and computer vision together. But the other piece of like mine is focusing on AI literacy at a school. Like as a professor, I try to focus my students to learn about how to track their patients, how to track their progress. It's not just like a passing printed version of the exercises and talk subjectively about their progress. So basically, AI is here assisting us, actually highlighting part of our practice that is always like a miss from and we need to educate our students. So education about the AI is also missing.
Okay. Well, you just said that term, so I'm going to make you sort of explain it, right? Because it's probably simple to you, but not to everybody else. You're an educator and founder. So what, from those two perspectives, does AI literacy actually look like for clinicians, students, all of us? What does AI literacy look like?
Right. So when I'm talking about like AI literacy means you can work basically first with the AI as an assistant, like a tool, not something that replacing you. Some people has a misunderstanding, if I learn AI, that may replace me. No, that's not the fact. The fact is AI literacy is like learning how to harness the power of AI and then use that ability. So for example, you need to learn about how to monitor your patients, looking at the computer vision outcomes. You need to learn about how to prompt the AI for like helping with the documentation, like helping like with like writing down the progress of your patient. This is another power. Other than that, how to integrate your workflow with the use of AI, like a simply like it can replace when we are prescribing HEP by the printed like a papers with just like a substituted with the RTM that is like equipped with the AI and monitor our patient just looking at the biomechanical outcomes. And that means like we should have it as a like a physical therapist enough literacy to look at the graphs and make a conclusion out of that, and also like a look at the progress report of the patient and make a conclusion out of that. This is AI literacy, and also integrated with our life, our progress, and also our workflow, knowing like where is the best to use the AI. And also the last piece is we need to learn how educate our patients about the use of technology, about the use of AI. Not afraid of that, being able to stand in front of the cameras, knowing how to do that. And that's all about like a literacy. So these are all pieces that are integrated as a literacy. And I think it should start at the school for these students, not when they graduated.
Yeah. So let's talk mindset. You've said that the biggest barrier isn't technology or regulation. It's something emotional. It's fear, which is most of the time, if you boil things down, that is the biggest barrier. Well, why is fear holding us back in this moment when to some of us like you, it's very, very clear the advantages outweigh the fear. So why is fear holding a lot of people back?
Yeah. Let me give you a simple example. When Google started or internet started to come to our life, a lot of like educators or a lot of us like afraid of like losing our jobs because, or like some teachers afraid of like, if people are able to search things like immediately, so they're not going to learn anything. This is the same fear. Like they think like AI is capable to do a lot of tasks, but they're afraid that it can do their job. But actually, this is not true. For a lot of jobs like PT, like physical therapy, we need to actually leave some of our documentation, monitoring, and also enhance our practice with the use of AI. Like when the clinician is absent, what else should we do? Obviously, the technology is the substitute. Like they can do it at home when we are absent. We cannot be present everywhere. But some people are thinking about it as like a replacement. So that mindset should change. We should embrace it, but we should know like what type of like how we should change our workflow, how we should improve and enhance our literacy, knowing about like where exactly in the software I should look up to infer the progress of my patient. This is something that is called literacy. And the mindset basically should change.
Understood. Let's talk in a second about what you're specifically creating. You're not someone who's just thinking about these things. You're someone who's deeply involved in executing on them. So we'll get to that in 1 second. I do want to say thanks to US Physical Therapy, one of the largest PT organizations in the country. And they're talking to you if you're a clinic owner, if you've built something special, but scaling that clinic and planning for what's next can feel overwhelming. US Physical Therapy can help you do that without you ever losing control of the thing that you've built. Find out more now online at their website, usph.com, and click on partnerships. Do also want to thank Brooks IHL, that's Brooks Institute of Higher Learning in Jacksonville, residencies and post-professional education in all of the subject matter areas, orthopedics, pediatrics, geriatrics, and kind of everything in between. Find out online if there's a path for you to where you want to be in your career at brooksihl.org. That's brooksihl.org. Now, Hoda, again, I mentioned you're a creator. So you're educating in the classroom. You're sort of switching lanes a lot, I would imagine, but you're staying sort of in the same domain. And one of those things I mentioned in the intro is you're a builder. So what are you building? What is it? Who's it for? And what does it do?
So I started with a group of friends during the COVID time. The startup company called HemScap, and we built up the Pivotal PT. And it's all focused on the patient monitoring, all pieces. And we have a computer vision AI that is for tracking the emotion. We have also the documentation piece that is basically doing like a progress note and also SOAP notes all together. And also like a full RTM, so like a remote therapy, like a virtual care, messaging, all devices or collecting feedbacks, all of the things that you can perfectly first harness the AI into our benefits, and second, harness the power of technology to help us grow. And when I started in 21 as a part of my postdoc as a in like AI in rehab, then I started to transfer the idea of like, who's going to learn about that? This is missing. How they can learn about all these complexities, because this is complex thing. This is not something like I learned in the PT school to be more like a hands-on person rather than a tech person. So no one in the PT school basically teaches you how to read the biomechanical outcomes. Like it's sometimes really hard to like look at the visual graphs and then infer and conclude out of those, or even like a read a report and make a conclusion out of this. Someone should teach them. And this is something like ended up me into in my faculty position, start like educating my students both like in two aspects. So I started a simulation based teaching of AI and patient monitoring in this school. And it was very successful. And I'm going to present it in the APTA CSM. This was something like a session of like a 3 hours that the students should learn about the use of AI. We use the pivotal PT, and they have to infer from computer vision AI outcomes and also the interaction with the patient, how to like basically they can teach their patient to use the technology when there is some hesitation with like around the patient. So that's what I thought the students in the simulation based teaching of the AI in the school. The other thing that I did was moving forward in integrated as a like assignment based type of a project over one semester, and I did it 2 semesters with that. And that was focusing on two things: clinical reasoning and also the application of AI. This was something like when I was reading this semester about the like feedbacks of the students, they really liked it because they never thought about like AI is not like replacing them. AI is something that can assist them improve their clinical reasoning, thinking about it. And there's a lot of room to improve it. But basically, this is a good start. This is something that they have to learn at the school. So I see like there's a kind of like a change of a lane. I did AI as a postdoc in my project for the diabetes, like a monitoring for the exercise monitoring, physical activity monitoring. And then I started a company put together. Now the company is very functional. It's very much focused on the clinical reason. This is the goal.
Okay.
And then now I'm on the education piece of that. And I think this is a journey that I can complete with the collaboration with some of the professors, some of the faculties that are like interested to bring up that type of like experience in their school as well.
Where should someone go to find out more information about what you've built and are building?
So about the HemScap, you can go to the HemScap.com or you can search Pivotal PT and find the product.
And
we're open to.
What are they going to find there? What they're going to find Pivotal PT, which does what for who?
So it does a patient monitoring for the for the physical therapists. They can message me there, and they can ask to use it for their clinics. This is something that they can find about the company. But about the education, they're feel free to go to the Samuel Merritt University and find me like in my bio over there, and then they can email me to my school email, and then we can start a collaboration like on the educational piece. So this is where like they can find me both in the company website, in the HemScap website. They can find more about like the monitoring is not solely focused on messaging communication, nor like a documentation. Computer vision is a part of it. Patient engagement is very important. That's what I thought also, like patient engagement, adherence of the patient to their plan of care. This is something that should be monitored in my educational. And also they can email me, and I will be in touch with people in the CSM, also APTS CSM, about how we can collaborate. This is something that I want to expand it to the other schools and see like what are the pitfalls of educating the, like improving or enhancing the AI literacy, both in the simulation based and also in the school based, like assignment based.
Real quick, your presentation at CSM, what's the title? And then what will someone walk out of your talk being able to do that they couldn't do before going to your talk?
So after my talk, they are going to gain an idea of how successful is going to be simulation-based teaching of AI, for the patient monitoring. Like they can learn about even one session of like 3 hours can enhance the ability or like the literacy of the students about using AI for patient monitoring. What we learn is it can to some extent contribute to their clinical reasoning, but basically clinical reasoning needs some digestion in kind of like a one semester of a project-based learning. But simulation-based learning is something that I'm going to talk about it, the outcomes and how we implemented the use of AI in and how was the interaction between a student and also the patient during the simulation-based teaching. And they will learn this is doable. This is something that the minimum thing they can do at the schools for helping these students to embrace the AI as a tool for, one, improving their patient care, secondly, for assisting them, and also this is something that is coming to our life and we need to learn about it and integrate it to the workflow. This is part of us these days.
Got it. You've said AI won't replace PTs. I've heard people say this before. It's not going to replace PTs.
Yeah.
But you say it will replace low value care. But what's that mean? What's that look like in practice? Help someone who doesn't understand what that means get it.
Mm-hmm. So again, I should say that again. AI will not replace physical therapists. Never. It doesn't have that capacity. So I tried both computer vision, generative AI. It can help and assist us in some aspects, but it's not replacing us. Where it has the maximum, assistant is where we are absent, which is when the patient is by himself at home and then doing their home exercises. This is where that we can use AI for supervision, basically collecting information from the patient performance progress, and then AI is able to kind of narrow it down, make an abstract report for us, and then we can take a look at the outcomes and get some idea about the progress of a patient. So rather than just simply giving them a printed version of exercises, physical therapy service can enhance, a homework system can be designed by the use of AI. This is where the maximum level of assistance by the AI. This is where we are absent and we cannot be present there at all. This is something that we will be always absent. The other piece is we have never reimbursed for the HEP. We have never get the benefit of home exercises. So now there are some RTM codes, especially in 26, that people can get reimbursed for that level of effort with the assistance of AI. And that is something that when I was practicing, that piece was always absent. It was not worth for a lot of us to spend more time with the patient digging into their home exercises because, first of all, we were absent always. We're not able to monitor patients at home. The second piece was we're not able to get reimbursement for that. So those two were barriers that we're not able focus on the home exercises very much or patient monitoring very much. But now this is coming to our life. This is something that basically like encourage in the 26 that RTM, patient monitoring, is something that like a kind of like a is a new topic. Hybrid care is now something is encouraged by the CMS, and so this is something that, and that's a, I mean, the home exercises is the lowest level of a care, but the maximum benefit of AI would be there. We can get the most level of the assistance over there.
All right. So again, we mentioned you're also in education. You do a lot of things, Hoda. But I'm going to let you have a pen that can rewrite all of physical therapy school curriculum tomorrow.
Okay.
What's getting, you don't have to worry about removing, because that is a problem, right? We got to remove something, we want to add something. But let's just say you can add a class or two or some elements. What would you add for the physical therapist or the physical therapist assistant for the next year, 5, 10? What needs to be put in there starting tomorrow?
Okay. It's, so what I do is I'm teaching the advanced topics in my course, in my class, and there is like a project that I integrated for improving the clinical reasoning with the use of AI. This is the minimum step that I was able to take it. But if I had to change the whole curriculum, I think the AI can integrate into the therapeutic exercises, to the physical therapy services, and people like students should learn about all these like pieces of using AI in different classes. So learn about how they can do the HEP with the use of AI. This is part of the therapeutic exercise class. As a part of like a PT services, they need to learn about like how AI can change the workflow from like only focus on the clinic base to the hybrid model, and they can benefit from also the HEP, like prescribing HEP. This is something else the people can do. The other piece is in the MSK courses, they need to teach the students to look at like the outcomes of like generated by the progress notes, documentation, and also by the computer vision AI. Look at the biomechanical outcomes, make them more like a data driven rather than very much observational. It's a little bit of a shift in how we do our courses, but not necessarily change the curriculum. It's more like making us like try to make the students more data driven these days, looking at the report, looking at the outcome measures, biomechanical measures, and then conclude. So I think that's the whole thing. It's going to be like several pieces that can like go into the curriculum, but not rewrite it from the scratch. The other thing is nowadays documentation is now very much enhanced by the use of like the saving time, money for us by the AI. So that's a lot, like that's another piece like students should learn how they can, even though they are learning probably like in the like a first year, for example, do the documentation from scratch, but maybe later on they can learn how to get the advantages of the AI and learn how to do the best documentation that has the highest level of the compliance, reflecting the progress of the patient in like a later years.
Understood. Hoda, we didn't prepare you this, but it's time to do the parting shot. Are you ready for the parting shot?
Okay.
Let's try it.
This is the parting shot. One last mic drop moment. No pressure, just your legacy on the line.
All right. Parting shot is brought to you by Empower EMR. Because your EMR should empower your care, not slow it down. So all the features you need, and you can find out the features right now at empoweremr.com. But the benefits are you're going to be able to spend more time with your patients. You're going to spend less time doing documentation because, of course, they have AI enhanced in their EMR. The things you need to empower your practice as a clinician and the things you need to power the back end of your business. EmpowerEMR.com. So Hoda, parting shot is just your last chance for a mic drop moment. What's the last idea, the final thought or sentiment you'd want to leave with the audience about everything that you talked about today?
Okay, basically two things. Okay. One is work on your AI literacy. This should start at school. This is something that simulation-based practice and teaching is one way. Doing the like assignment-based throughout the semester is another way. I'm sure like there are other ways to enhance the AI literacy. The second thing is students should learn about the hybrid care, like a remote and also in person, not solely focus on the virtual like meetings. So this is not the case basically. So learning about like how to do clinical reasoning out of communications, out of the AI outcomes, out of like the progress notes. And this is something that should be integrated together. And patient monitoring is the big piece of our practice that can kind of like a guarantee our success, because we have a homework system. Like if you leave the student by themselves, they may not get enough success. But when we had started a homework system, so we had enough success, this is the AI is doing the same thing for us.
Understood. If someone wanted to contact you, what is the single best way for someone to reach out?
So email me at hsalsabili@hemscap.inc.com.
Perfect.
And that's the best way.
Perfect. Hoda, thanks for doing what you do. Thanks for trying to make this complicated thing simple and making sure everybody can keep up. And hopefully in a year, 3, 5, we see more programs putting the stress on this AI literacy so we can empower our clinicians and then empower our patients.
Perfect. Thanks, Jimmy, for having me.
Appreciate it.
That's it for this one, but we're just getting warmed up. Smash follow, send it to a friend, or crank up the next episode. Want to go deeper? Hit us at ptpintcast.com. Or find us on YouTube and socials at ptpintcast. And legally, none of this was advice. It's for entertainment purposes only. See, Keith, we read the script. Happy now?